We have a case of a reverse pupillary block in a type 2 angle dysgenesis. We are talking about a 22-year-old male. He had a history of ROP in both eyes. He underwent phaco and IOL implant in the left eye. He had advanced damage in the left eye. He was referred to us because of very high IOP and not responding to the treatment that you can see on the screen with maybe urgent surgery recommendation in the left eye. We can see a very deep anterior chamber, which is an interesting finding. Also, you can see in mid-periphery of the iris an S-shaped of the anterior surface of the iris, which can tell us an idea of what is going on. Here we can see another view of the mid-periphery, and we can see how deep the chamber was. We also see that there was a touch of the posterior surface of the iris and the anterior surface of the lens with deposit of pigment on the anterior surface of the lens all around the pupil edge. We can see also here how the high iris insertion was visible, which is a characteristic finding of the type 2 dysgenesis. Here is another view of the same finding to make it easier to see how high the iris was. This is an OCT image of the anterior chamber. We can see the atrophy of the mid-periphery of the iris, and we can see how deep the chamber was and how the iris is pushing back on the anterior surface of the lens of the IOL. So this tells us that there is a high pressure in the anterior chamber. So we went ahead and did a peripheral iridotomy right there on the spot. We put the patient on Pilo, a combination of dorsalamide and timolol, and bimatoprost at night, and we called him back for checkup the next day. We did 3 iridotomies. It works better for me if I do more than one in these cases. And we can see how now the anterior chamber is more shallow. You don't have the S-shaped iris anymore. You can see the iridotomy at 12 o'clock, and it looks like it's looking better. We see the OCT of the iridotomy at 12 o'clock. We can see it's a full thickness defect, and now this is my favorite picture, how the anatomy is normalized. We see the space between the IOL and the posterior surface of the iris. We see the iris is in a straight shape, and the best part is the IOP went back to 16 millimeters of mercury. Thank you very much.